Assalamu alaikum. I'm Dr. Umer Salim, consultant pulmonologist. As we were discussing FCPS Pulmonology April 2015 paper, the next question is on your screen now. A 35 years of aged male, known case of asthma, presents with fever, sudden onset shortness of breath, wheezes and expectoration of brownish plugs. On examination, hyperresonant note on the right hemithorax with absent breath sounds were observed. Chest X-ray shows consolidation with air bronchogram on left upper zone, and there is right-sided pneumothorax. When old chest X-rays were retrieved, the left consolidation was present on right side 2 weeks back. CBC shows neutrophilic leukocytosis with 15% eosinophils. What is the diagnosis? Write 4 tests for the diagnosis, and part C is write 4 steps of management. So as you can see, the patient is young male with history of asthma and the sudden history of fever, shortness of breath, wheezes and cough with sputum, and the patient is expectorating brownish plugs. So keep in mind that the patient has history of asthma and something sudden or as a complication is going on in the patient of asthma. As one complication, we can see the patient has pneumothorax, but we are more concerned with these new symptoms. What are these? It can be a new infection, any pneumonia in a patient of asthma, or we should think of something else, as the patient has 15% eosinophils in the blood with leukocytosis, and the patient has fleeting shadows in the chest X-ray. So our diagnosis will be allergic bronchopulmonary aspergillosis. Write 4 tests for the diagnosis. The 4 tests for the diagnosis of ABPA are skin prick test for aspergillus antigen, serum IgE levels more than 1000 nanogram per ml, serum IgG antibodies against aspergillus fumigatus, and HRCT chest, which will show bronchiectasis, which is proximal. Okay, the part C is we will admit the patient in ICU. You have to give systemic steroids, antibiotics. Meanwhile, you have to send sputum culture and start itraconazole. Liaise with thoracic surgery for chest tube thoracostomy and chest physiotherapy and posterior drainage. I hope you understand the question, and if you need any help regarding the description of the question and more detailed answer of this question, please give me feedback in the comment box. Thank you so much. For more solved cases, get this book in nominal price from local medical bookshop or online nationally and internationally from links below.